Hi, I'm Dr. Joe Niamtu, LoveThatFace.com. If you follow us on YouTube, you know that we have over 100 videos on cosmetic facial surgery, and we have an osteoma video. But today, we're going to do a video on endoscopic removal of osteoma. Now, an osteoma is a little bump on the bone. They're very frequently on the forehead, and since I just do head and neck surgery, that's where I'm usually treating osteomas. And they can be a result of trauma, somebody that got hit in the head and had an injury, and it later forms a little bone spur or a little lump, and it's just like a little knuckle or grape of hard tissue of bone sticking out through the skin. You know, they're benign, and obviously you want to make sure several things, that in fact it is an osteoma and not some type of hard or soft tissue tumor or other pathology. And we always do in-office CT scan to make sure that the osteoma is superficial and doesn't connect with the deep part of the skull or any other deeper structures. So endoscopic surgery is very popular, and we do that for brow lifts, and orthopedic surgeons do it for shoulders and knees, and it allows minimal incision access. So if we do an osteoma with an open technique, we still do a very cosmetic incision in the brow and in the hairline, and we can go in there and actually look at the osteoma by lifting a flap up and reducing it. And for real big osteomas, you may have to do that. But we frequently treat smaller or medium-sized osteomas endoscopically. So if you look at the video here, you'll see the instrumentation that this is called a sucker shaver instrument, and orthopedic surgeons use this to treat various joint maladies. And you can see that we're reducing the osteoma, and it's actually just shaving this down. And remember, this is magnified because it's an endoscope, and you can see the little shavings, and we're irrigating that and sucking them out. And then we'll take a little instrument and file that and smooth it down, and then finally a very fine endoscopic instrument to smooth the bone and get rid of the hump. So the whole thing takes about 20 minutes. It's 2 little buttonhole incisions up in the hairline, and it's just a really neat way to use technology to treat osteomas. Thank you for watching, and take a look at other YouTube videos. I'm Dr. Joe Niamtu, LoveThatFace.com.